Do you know why Tina, Lucas, and Tanner are so realistic? One important reason is because of Cheryl, Amanda, and Brittny. As you may know, Tina, Lucas, and Tanner are just three of the digital standardized patients that are part of Shadow Health simulations for undergraduate and graduate nursing programs. These digital clinical experiences are a vital part of the education of more than 700,000 nursing students across the country, giving them the opportunity to practice as often as they need with realistic, simulated patients. And that is where Elsevier's nurse educators come in, specifically the team of Dr. Cheryl Wilson, Dr. Amanda Davis, and Dr. Brittny Chabalowski. The three women are embedded within the Shadow Health Development Team and help create new simulations as well as continually updating current ones to reflect changes in the language and practices that nurses use. Prior to joining Elsevier, Cheryl, Amanda, and Brittny all worked as nurses and then nursing faculty. As faculty, they implemented Shadow Health into their courses.
Regarding Shadow Health, I've been a strong proponent from day one. I was involved early days with seeing the product, and I really saw the value of being able to learn in a virtual environment and to get feedback right away, have students practice their communication skills with a patient. It's something that I saw very early with the product.
Shadow Health helped us get training out to students in a different way that could be even more accessible than traditional clinical training. I think it's very important to have that safety net for our learners.
I could guarantee when using Shadow Health that students would have an equal opportunity to do all the skills that I was expecting and show me how well they're doing it. It would give them the comfort of saying, okay, I've practiced this in a safe space.
Now, as members of the Elsevier team, the three work side by side with developers, narrative designers, learning designers, product managers, and others to bring their expertise to the Shadow Health simulations.
So when we begin working on a new offering, a new product, a new assignment, we have initial conversations to make our patients in Shadowville represent more of what the United States looks like. We all come from very, very different nursing backgrounds, which makes it really great to sit down and brainstorm various types of cases. But we don't do this in a vacuum. As an example, when Shadow Health developed an LGBTQ plus patient, we worked with experts in the field to help ensure our language is how a real patient would respond. We wanted to ensure that we had authentic, appropriate interactions with patients so that our learners can have those very realistic experiences.
Our team acts as the bridge between the nursing side and the creative side. For example, my experience is generally in the ER and trauma world. So the patients that I'm used to interacting with in practice are typically not thrilled about being in the hospital. They're in crisis mode. So for example, a patient may not be as forthcoming with information that we need, or they may become irritated with repeated questions about their medications. The digital clinical experience has those types of real-world scenarios that nurses will likely encounter.
Language, specifically phrases and terms, change over time. We make sure our simulations reflect these developments to continue to model therapeutic communication for our learners.
The three women get great satisfaction knowing that the Shadow Health simulations help scale their expertise to a wide audience, and that coming generations of nurses will have the best preparation for difficult conversations.
I didn't realize the reach that we had until I was at a conference and in the booth working as part of Shadow Health and Elsevier. And faculty would walk by and they would see one of the characters on the screen, like Lucas or Tina, and they would shout, Lucas or Tina, like they knew them very well.
I think that's the most fun part of our job. We really get to bring these characters to life.
All the work that we put in behind the scenes is going to benefit the greater good of the profession.
We develop the patients and send them out into the world. They become almost like our children. We're very vested in ensuring that we have the best patients developed for learners when they're interacting with them.